Hello, welcome to Kasyapa Ayurveda. Today we are going to discuss about piles, otherwise called hemorrhoids. You know, piles is the most commonest disease among the people among India. Actually, nowadays we are more getting prone to get piles. Many conditions are there which arises in the anal region, or otherwise called which occurs in the anal region. People will call it as piles. For example, sometimes if you have a pain in the anal region and you have pain while going for defecation, while doing defecation you have pain, you may have burning sensation, there may be slight bleeding and all. You may think that you have piles, but it may not be, because there is a condition called fissure in ano. The fissure is the wound which arises in the anal region. That is not piles. That pain can be due to fissure. Many of the time, piles are not painful. Piles are usually painless. So, how to identify whether you have piles or whether you have fissure or some other conditions like fistula in ano, otherwise called fistula, anal fistula. That is also a condition which arises in the anal region. And there can be some skin conditions like warts or skin tags or some serious conditions like carcinoma, cancer. Those conditions can arise in the anal region. So there are many diseases which comes around the anal region, not like piles. Every time any pathology in the anal region is not piles. There's a chance of piles, but most of the time people who are coming to the clinic, like piles clinic, usually suffers from some other conditions, not piles. So you have some problem related to anus or problem related to your anal region, you have to know that which condition you are suffering from, whether it is piles or some other condition. That is, I am going to tell how to identify your piles and how to treat your piles. So let's go for the discussion. What is the symptom of piles? How to know whether you have piles or not? Piles are usually painless. There are 4 stages of piles. What is the first stage? First stage is that you will not be, occasionally you may have some constipation or something like that, and sometimes you may have bleeding. Once in a while, whenever you go for toilet, you may experience that there is mild bleeding without pain. There will not be any pain or burning sensation like that, but you may experience mild to moderate amount of bleeding. That bleeding occurs after the defecation, after the stool passes. After the stool passes, there can be a splashing of blood. There can be water coming from a tap or something like that. Blood flows. That is called splash of blood. That will in the toilet. You can see the splash of blood in the toilet. That can be occasional or that can be daily also. So some people are getting bleeding daily. Some people are getting occasional bleeding. So that is the initial symptom of piles. Remember that condition usually not associated with the pain. There will not be any pain. It is a painless bleeding. Next stage, that is the second stage piles. Bleeding may subside. Some people's bleeding will subside without any medicine at all. But some people's bleeding will continue in the second stage also. In second stage, there is slight prolapsed mass which comes out of anus. While doing defecation, there is something mass which comes out. You can feel with your finger. and it goes by its own. It goes by its own after defecation. So in that time also there is no pain. You may feel very slight, initially it is very slight mass, very small mass, and it is not comes out always. You have a constipation, that time the mass comes out. If bowel movement is smooth, that may not be. Initially it is like that, and it keeps on increasing. And it keeps on increasing, and at end of the second stage, you may feel that there is a considerable amount of mass which comes out, and it automatically goes without any pressure. You may not have to put pressure and insert. No, it automatically reduces by its own. That is the second stage. And third stage is, you have the bleeding will reduce. There will be very less amount of bleed, or sometimes there may not be any bleed also. There is no blood, but the mass comes out, and it will not go automatically after defecation. You may have to do some pressure. Initially that pressure is less pressure is enough. You may have to push it, and that will automatically reduce it. And without pressure, it will not go. That is the third stage. And the fourth stage is, the mass comes out and it will not go. It stays there only, and even if you press, even if you apply pressure, the mass will not go inside. That stays there only. That is the fourth stage. These are the four stages of hemorrhoids. Initially there is bleeding, no mass comes out. Second stage is, there is slight mass comes out and with the bleeding. Third stage is, bleeding stops and mass comes out and stays there. It needs manual reduction. Fourth stage is, mass comes out and it will not go inside. It stays there only. In that stage, patient may have pain. Some patients may have pain. Only in that stage. Otherwise, some other type of hemorrhoids, that is the complications of hemorrhoids, that mass comes out and it can't go inside due to the spasm of the muscle. There are circular muscles like this. There are circular muscles in the anal canal. When that muscle contracts, anal canal closes, and when it relaxes, anal canal opens. Just like this. When this muscle closes, anal canal closes, and when muscle relaxes, anal canal opens up. So while defecation, what happens? The muscle will relax and the stool pass out, and automatically the muscle will contract and anal canal will close. So when the prolapsed mass, that when the piles comes out, sometimes what happens, because of irritation, because of the edema, that is edema is called swelling. Because of swelling, there can be an irritation to this muscle. Because of that irritation, the muscle will go for spasm. Just like muscle spasm in our leg or like that, you may have experienced that. The muscle will suddenly contract. So that type of spasm it may happen due to the swelling. So sometimes what happens, because of that swelling, muscle suddenly go for spasm, and the prolapsed mass cannot go inside because of spasm. The size may not be much bigger. Sometimes in third stage or second stage also it happens. Because of the swelling, sudden muscle spasm occurs, and usually it goes inside, but now it is not going, and it becomes with severe pain. That time there will be severe pain, like that patient complains. Patient comes suddenly to the hospital and telling that I am having severe pain and there is a mass comes out, and it is not going inside. I am having severe pain, like that patient will tell. That is another type of hemorrhoid. That is a complication of the pile mass. That is called strangulated pile mass. Only in these 2-3 conditions, piles will be painful. Otherwise, normally piles are not painless. So if you have pain while defecation, pain while passing stools, and if you have burning sensation, you just understand that there is no piles. That is not piles. There is a chance that piles plus another condition will occur, coexisting. Piles plus fissure will coexist. piles plus hemorrhoid, fistula will coexist. That is a possibility, but usually if you have piles, there will not be any pain. So pain is not a symptom, or burning sensation is not a symptom of piles. So that is the main symptom of piles, that either it can be a moderate amount of bleeding, not severe bleeding, moderate amount of bleeding, and a mass comes out of anus. That is the symptom of piles. Another symptom is itching. You may have itching. Every patient may not have itching. Some patients may have itching. You have constipation. Many of the patients may have constipation. Because of constipation, that is, constipation is a causative factor of piles. Because of constipation, there can be piles. And if pile mass is bigger and bigger, it becomes bigger and bigger, there is increase of constipation. It will be very difficult for the patient to pass stools. That is another cause of constipation. So, what is the causative factors? I have explained about the symptomatology, about the symptoms, signs and symptoms. So, next we say about causative factors. What is the causative factor of piles? How it happens? Many of the people, it is hereditary. If your father or ancestors, mother or ancestors have hemorrhoids, there is a chance of getting hemorrhoids to you also. So piles is a hereditary disease. There is always a chance of hemorrhoid in you if your ancestors has hemorrhoids. So another thing is, there are some predisposing factors. If you have hereditary and if you not have hereditary also, you can get piles. That is, second thing is prolonged sitting. If you are sitting for a long time, for example, if you are a driver, if you are driving for long distance, and if you are a office worker, you are continuously sitting from morning 9 o'clock to 5 o'clock. If you are continuously sitting for long, that is the major reason of getting hemorrhoid. The third reason is constipation. Constipation is the third major reason to get a hemorrhoid. So if you are, many people who has constipation, they will always put strain to defecate. If you are using much pressure for passing stools, that is another causative factor to cause a piles. So this is the third causative factor. And the fourth one is your dietary factor. You are having a habit of taking more non-veg items and food which less in fiber. If you have a habit of taking more spicy food items, you may experience hemorrhoid. So these are the 5 major reasons to get hemorrhoid. So what is hemorrhoid actually? What happens inside? You are coming to the pathology. What happens if you indulge in these causative factors? Whenever you put pressure on those areas, whenever you put pressure on while you are sitting for long, there is a chance of getting more pressure on that area. And if you are giving much pressure while defecation, and if you are applying more pressure while defecation, there is a chance of increased pressure in that area that will lead to weakening of that area. There are blood vessels in that area, so there is a chance of weakening. Those blood vessels go for weakening and starts ballooning. You know that if you put much pressure in the balloon will increase, the balloon will blow. Like that, the pressure, the suction pressure, that pressure will lead to ballooning of that blood vessels and it causes prolapse. So the pile mass will keep on increasing in size. So that initially there can be rupture in the blood vessel, and that rupture leads to bleeding. So that bleeding is much more, moderately high amount of blood will come, and after some time, because of the fibrous tissue formation, because of healing, that bleeding stage will stop and the mass will keep on increasing. The mass will keep on increasing, and that will comes out as prolapse. So what is the option for treatment? So in modern medicine, that is allopathy, there is no medical treatment. They use many methods to remove. They want to remove the bile mass, so they will cut it, like hemorrhoidectomy. That's a treatment. Another treatment is putting a rubber band on the bile mass, and the bile mass will automatically shed off within a week. That is another method, that is called banding. And laser treatments are there, and cryotherapy is there. There are much methods to reduce the piles. In Ayurveda, there is conservative management of piles. Like you can take medicines that will help to reduce the bile mass, that will help to reduce the blood bleeding and all. So the bile mass will be reduced. The mass of size of the pile will be reduced, but it is a temporary thing. If you have a small primary amount like first degree or second degree, first stage or second stage, that will be cured within medicines. But if you have third stage or fourth stage, it is difficult to cure with medicines. In Ayurveda, we do some other type of treatments like Kshara Karma and Kshara Sutra, Agni Karma. So these are the methods we use for treating hemorrhoids. Those are simple procedures. You can come to the hospital and do the procedure and go home. That's called daycare procedures or OPD basis procedures. There's no need of admission and all. And you can come to the hospital, do the treatment, and evening you can leave the hospital. That type of treatment. So Kshara Karma is what? First thing is Kshara Karma. Kshara Karma is what? Applying Kshara, that is alkali, chemical alkalis, that is herbal alkalis, which made out of some herbs, alkali preparations. That paste will apply. That will be applied by the doctor, not by the patient. You have to come to the hospital and you have to apply the paste, and the bile mass will be burned because of the potency of the medicine. The bile mass will be burned, and you can go home. There is slight bleeding and all. There will be slight burning sensation and pain for a week, and the bile mass will automatically shut off. That is the one thing that is called Kshara Karma. Kshara Sutra is a medicine paste which is applied on the thread, and that thread is tied on the bile mass, and the bile mass will be shed off within a week. That is another procedure called Kshara Sutra. That is also a daycare procedure. Then third one is Agni Karma. That we do for some other type of hemorrhoids, that are external hemorrhoids. We can cauterize that hemorrhoid by using an instrument. We cauterize the hemorrhoid, and you can that time itself, no need of waiting and all. That day itself, we can remove the hemorrhoid. That we do for a particular type of hemorrhoid. So these are the three procedures usually we do in Ayurveda for treating hemorrhoids. These procedures are much effective and without side effects. Like if you do hemorrhoidectomy, there is a chance of losing the sphincters. I told you that there is a circular muscles. If you cut these muscles, the weakness of these muscles, and there is a chance of loss of strength of that area. That leads to rectal prolapse in future. Like your rectum will comes out. That can happen. But in this Ayurvedic procedures, there is no side effect like that, and there is no need of admission, and there is much cost effective and simple procedure without any side effects. So these are the procedure usually we do in Ayurveda. So I will tell you some tips to reduce the bile mass and all. You can go for sitz bath. That's a very good method to reduce the size of the bile mass. Take as basin in which you can sit inside, and pour some hot water and put salt, and that you can go for doing sitz bath. Second thing you can do is you can take more fiber-rich food. You can take more vegetables. You should take more leafy vegetables. You have to take curries and all. You can take more vegetable salads, and take more fruits, and take more water. You have to increase your water intake, and walk for a while, like walk at least for 45 minutes daily. That will reduce the constipation. So automatically your bile mass will be reduced. So these are the methods you can adopt in home, and you can consult a doctor, an Ayurvedic doctor, who is practicing the treatment of hemorrhoids. In all over India, there are so many doctors who are practicing hemorrhoids. So you have to go to an expert and get your piles diagnosed. Always for diagnosing piles, hemorrhoid and fissure, piles, fistula and hemorrhoids, there is a need of an expert to view or to visualize. Some examination should be there. Some simple examination is needed to diagnose the pile mass always. So better to go off to an expert and get your piles treatment done. I think it is useful for you. Please share this information if you feel it is useful, and do subscribe our channel.